Okay, let's go ahead and get started. My name is Keith Justice, and I'm with Healthcare Solutions, and this is a presentation of our product called ChartGuard for NextGen. Okay, so for the agenda for this presentation, we're going to talk a little bit about what ChartGuard is, some EHR dependencies, and why practices by ChartGuard, a little bit about how it works. They'll actually do a demonstration, and a brief iTenov overview. And then we'll take all your questions at the end here. So actually, before we get started here, must have missed a slide here in my presentation. I apologize for that. But we will be introducing you to Joe Schultz. He is the director over our Product Solutions Division and was a instrumental person in actually building this product. So we have great news to have him on this actual presentation. So any question you bring up, it can be technology related or it could be process related, any of that kind of stuff. He'll have the answers to that. So Joe, you want to pop in and say hi real quick? Joe? Oh, maybe not.
Thank you. Thank you everyone for taking the time to join us. We really appreciate it. We've been overwhelmed by the interest in ChartGuard, so hopefully you'll find this webinar very interesting, and I'll be back in the middle of the presentation to take you through some of the details.
Thanks, Joe. Appreciate that. Okay, so what is ChartGuard? Well, very simply, it's a business continuity solution that ensures the availability of your patient charts during an EHR downtime. So let's make sure we understand that. It's really designed for business continuity. This is not something you would use for a disaster recovery solution. There are other solutions available that iTenov can help you with, but from the standpoint, this is really designed for business continuity. If there's any interruption during a day or a 2-day or 3-day, things like that is where this solution really comes in handy. And you'll get a better understanding of that as we go through this further. So what are some of the EHR dependencies? And I'm sure some of this stuff is redundant for you folks. I'm sure you know exactly what this stuff means and what those interruptions mean. But basically, there's complex technology behind your NextGen environment. Even if you have this thing hosted somewhere, you still have to have certain things in place in order to be able to get access to NextGen. So there's servers, workstations, you've got local things like your tablets and scanners, you've got local networks from T1 lines to VPNs, wireless connectivity. If you are hosted, you'll have internet connections or MPLS networks. You've got things to consider when it comes to power and cooling if you have it on site. And loss of access to that EHR, I'm sure this is no surprise to any of you here, is the quality of care can be impacted. You have loss in productivity, lost revenue. You can find, this is a statistic that's really easy to find out on the internet, but one group of statistics then is downtime. The cost of downtime is $488 per hour per provider, and there's multiple sources out there that'll reference that statistic. So it's been analyzed over and over and over. And I have some actual examples I'll show you here in just a little bit. And then besides all that, the ability to take care of your patients, it can be embarrassing, and it can affect your reputation if you have a whole room full of patients they're trying to be seen by your providers, and then your system goes down. We all understand that. That is embarrassing. We get it. So what are some of your options when you have downtime with your EHR? Well, you could temporarily close the practice, and that's not always a good idea to do that. You could drop back to paper charts if you've even manually maintained them, because they are labor intensive, and most people are beyond that anyway. I've come across very few practices that still have paper charts as a redundant solution. Or you could spend a lot of money in fully redundant technologies. You could have redundant servers with failover, redundant network equipment, storage area networks, with failover. You could have even multiple data centers from a hot spot to or a hot site to a warm site. You've got power to consider, cooling to consider. So there's a lot of things that you could spend a significant amount of money just to ensure of that uptime. So even for hosting has its risk with access. We've got several practices that have a connection to their hosting provider and then have secondary connections with failover routers in order to be able to ensure that uptime as long as you can. But in either case, in either case, you have some kind of a protection for that disruption in service. So let me give you some quick examples here of some of the most recent failures and why people have bought ChartGuard from. One particular example here is a data center that actually shut down because their cooling system had failed. The drain plug had gotten plugged, and so the air conditioning shut down. It heated up the server room. Now the good news is the servers had their built-in technology to shut down before they had any catastrophic failure. But the point is, when you have those servers shut down like that, you first have to get the air conditioning fixed. Then you have air out the room, and then you got to stand those servers up one at a time in a certain sequence so that everything connects correctly. That can be up to a 4 to 6 hour interruption just by having your air conditioning drain plug plugged up. So you need to have some kind of contingency plan to be able to see those patients that are still standing in the waiting room. We've had another example where a sprinkler line failed and it actually flooded the server room. Now again, there was an example where the sprinkler wasn't even in or even close to the server room, but because it was unrecognized until people came in the next morning, it had sent water all throughout the building. And so this particular practice didn't have any catastrophic failure either because they were able to get to their network equipment and get it all shut down before they did have a problem. But still, there's an example where they could not see patients that day. Even if they did have dry areas in the building and other places where they could see patients, they had all their network shut down. We've seen a storage area network logical unit detach from the storage area network, and all of a sudden all the host servers couldn't see anything, couldn't get to the data anymore. And again, they had to go in, reset that stuff, get the vendor involved, find out what happened, and just time ticks on, and the longer your patients wait in the waiting room is a bad thing. We've seen network equipment switch failed. It could be a firewall, it could be a switch, could be anything, could be a satellite office problem where their data is not accessible just because their switch or network equipment failed out in the office. So that's the beauty you're going to see here in a little bit when Joe starts to talk about the solution. You're going to see that this ChartGuard is actually placed in each one of your local offices, in satellite offices. So that's the nice part about it, is that it's not even centralized in your own set of practices. It's actually distributed out between your different locations, and we'll get into more details on that as well, but that's pretty cool about this solution. You might recall here a few months ago where Time Warner had an outage for 3 hours, and it affected 11.4 million internet customers. Now, fortunately, it was at 3 o'clock in the morning, so it really didn't hurt a lot of people, but can you imagine what happened if that was at 8:30 or 9 o'clock in the morning? How many people would have been affected by not being able to get access to their information, especially if you had satellite offices coming into your data center or if you were hosted? You've got to be able to get to that patient information so you're not shutting down your practice. But really, after all these examples I've shared with you so far, the #1 reason why people lose access to their electronic EHR is the backhoe. In 2012 alone, there was 185,625 cases where telecom cables were damaged in just that year, just 2012. So using a 10-provider practice example and that $488 we used earlier, for 4 hours of downtime costs for 10 providers was a loss of revenue of $19,520 just in the one single occurrence. So to have a solution like ChartGuard in place could not only protect you against that, but you just never know what kind of occurrences you could have during the year. So we thought we'd share with you a recent testimony that was actually back here on December 9th. A client of ours had a WAN outage that took out their NextGen access to 2 of their largest clients. And thanks to your product, we did not have to close the clinic or turn away any patients. We were able to keep our clinics at least functioning, and the doctors were pleased with our backup plan of ChartGuard. His name was John, and he was the network manager for this practice. I would love to tell you the practice's name, but he hasn't got back with me yet to use his name as a reference. So we're just going to have to go with it this way for right now. But anyway, it was a really cool testimony to have him call in and say, hey, we got to use your solution, and it worked out great. So we really appreciate you sharing that with our practice. So one last thing here, when it comes to HIPAA, there is a contingency plan that you're responsible for in your practice, and this solution just adds to that response to the emergency mode operation plan is really what this addresses, but it does help you in your contingency plan and responding to that from a HIPAA perspective. So ChartGuard itself, it is an affordable business continuity solution that ensures your practice is productive, it's profitable, and secure during EHR downtime. So here's where I'm going to bring Joe in now, and I'm going to let Joe kind of explain to you just how this thing works and how it's laid out and how the data is collected and distributed across the different satellite areas. And then he's going to get into a little bit about customizations, what you can do with the product. And then I'm going to come back in later and talk to you about the different versions of the software, and then I'll give you a quick little overview of iTentive, a real short overview of that, and then we'll get to all the questions. All right, so Joe, let's go ahead and bring you in.
All right, Keith, thank you very much. And again, thanks to everyone for attending. When we embarked on creating ChartGuard 3.5, almost 4 years ago now, we had some requirements for how this thing should work. And we were working with a practice in the southern United States where they had a lot of thunderstorms roll through. And those thunderstorms would routinely knock out the networking to one or more sites. So you think about your outages as the data center goes down or the database server gets corrupted and everything's offline. But you also have to consider, if you have multiple sites, what happens when one of those sites goes offline, and kind of think about how often that happens in your environment, that a particular site ends up offline. So the ChartGuard solution had to be a workable solution even when a site was off the internet or off the private network. Okay, if the site was fully isolated, could you still get to your clinical data? And that was the big question. So we sat down and we kind of ruled out kind of a cloud-based version of storing the clinical data because that required internet access. So what we arrived at with ChartGuard is really to create an electronic version of the paper charts that gets pushed out to the appropriate sites every night, so you have that clinical information already on site at 10 a.m. when the backhoe down the street cuts into the network cable and that site goes down. So this is an important differentiator with ChartGuard, is that it does survive in an offline mode when you can't get to any networking outside your building. You're basically, by our standards today, kind of back in the Stone Age. So the way ChartGuard works is each night it's going to go out and look at your NextGen database. It's going to query your appointment schedule, and it's going to create PDF versions of the old paper chart. And you know those PDF files, right? We're downloading them on the internet. You can open them on practically any device, your PC, your Mac, your Android phone, your iPhone, your tablet. So the nice thing about PDFs is that they're what we call portable, right? And that you can open them pretty much anywhere. So ChartGuard is going to create these PDF files of the patient charts, one per patient, and it's going to copy them out across the network. If you look at this diagram, we have the center, which is your database server for the EHR, and then we have your remote sites, which these charts get copied out to. That way, when one of those lines going to the remote sites gets cut, it's already there. That's the beauty of the system. And we're going to copy out typically several days looking forward of appointments, so you have the vast majority of your clinical data already on site, already available to keep your practice running smoothly. In addition to the patient charts, each site is also going to get an appointment listing, because we all decided at the beginning it would be useful not only to have a whole bunch of charts out there, but also to know who's coming in and when. So we're giving you the essentials for your practice to continue to operate at a time when they're offline for any of a multitude of reasons. And again, this was designed into ChartGuard from the get-go. It's, let's have a system that's easy to use, hence the PDF files, that survives network outages. This is the reason every night those charts get copied out to the remote sites, and keep our practice running smoothly. So what gets copied out to the remote sites? Well, let's take a look here at the deliverables that are inside each of the charts. Okay, as I mentioned, the sites are each going to get their appointment listing so they know who's coming in. Within the chart itself, you're going to get a patient data sheet giving the demographics and some of the relationships, giving the insurances. You're going to get your module data from NextGen. So your medications, allergies, now immunizations is a module. So we've updated ChartGuard to take advantage of that. Part of how we keep ChartGuard in sync with NextGen over time. You get those new features. You're going to get things like your vitals. You're also going to get your EHR documents and your ICS documents. So all of those things that you'd need to see a patient are going to be bundled up into this PDF file. Now, some of you might be thinking, wow, we have some patients that we've been seeing for 10, 12 years on NextGen, and their file would probably be 100 pages. Well, as part of the configuration of ChartGuard, we can work with you to set what we call the depth or the history on particular documents or modules. So is it give me the last several months or give me the last several of these in quantity or both? And that way we can tune with you what those charts will look like so you get the relevant data that you need each night. Finally, the last great thing about this is once you've set up ChartGuard and you have it running, it's out there doing its work every night and you don't have to worry about it. It's, as we say at the bottom of the slide here, set it and forget it. It sends you an email report when it's done running of the number of files copied, where they were copied to, if it had trouble reaching any sites, so that you're aware of that and can look into that the next morning. But again, it goes back to this ease of use for ChartGuard. We're giving you the clinical data. It's going to be available when you need it, where you need it. So NextGen is a fully customizable system, and we know that many NextGen systems are different. Almost no two are the same. So if you talk to your other friends who are using NextGen, you realize that you all have little nuances to how you've configured NextGen and any customizations you've done and so on. So we've built this into ChartGuard, this flexibility, so that we can handle different versions of KBM, different customizations, and that's one of the things we'll work with you on during the ChartGuard installation. In fact, Itenov, in its software products model, purposefully decided this isn't a, ship you the USB drive and you go install it yourself. We'll work with you through the installation and through your user acceptance to make sure that you're getting a system that works and does what it was promised to do. Because basically at the end of the day, we want to make sure that if you have an outage, that you end up like our friend John, who we showed the testimony from a couple slides ago, and can shoot us an email and let us know how great it was for you. Okay, so next I want to show you what one of these charts looks like and one of these appointment listings looks like. So we're going to flip over to a different machine temporarily, and then we'll flip back and I'll give you a sample of a chart from ChartGuard.
All right, Joe, I think I just threw it over to you.
Yep. Okay, so let's say we're out at our satellite location and the network just went down and we've lost our access to NextGen. So what do? We go on to our PC at the site that's designated as the host for ChartGuard. We go into a shortcut that would be on that PC that takes you to the folder containing your charts, and then we can go down into that folder and find our appointment listing to let us know simply what patients are coming in today and at what times. So we have a sample appointment listing here. This listing, as it said on the prior slide, can be customized. So if there's a user-defined field or the details field that you need here for it to be more meaningful about why the patient's coming in, we can go ahead and work with you to get that on this report. Because again, the end result, we need your practice running smoothly during an outage situation. So that gets created automatically and copied out to each location, giving each location their reports. Okay, so the charts themselves can be sorted a multitude of different ways. Right now for our handful of sample charts, I have them in the same folder, but if you want them sorted by provider or provider subgroupings, we can go ahead and do that too if you're at a site with a number of providers and a number of patients coming in each day. Just to make the charts easier to find, they can be under each provider so that you know right where to find them and you don't have the noise of the other charts. Plus, from a HIPAA perspective, it provides some partitioning of who gets to see that patient information. So as promised, I'm going to dive in here to one of the patient charts. So I'll go ahead and bring up John Doe. And again, we double click on this. It loads up in a Adobe Reader, which again, almost every device out there these days has some form of PDF reader either on it or available for download at no cost. So that's the reason we went with a PDF file for these. It's just universally usable. So we get our first page, which is our demographic sheet, our data sheet for the patient, which gives you the basics about that patient, right? The demographics, the employer, the insurances. So it gives the provider kind of an idea of what their coverage would be and you know, where they're from and so on, so they can verify, obviously, they're on the right patient. So let's go ahead and scroll down through the chart. So we hit our module information first, and our default order for the chart. This ordering can be changed as part of the configuration. So we have things like allergies, medications, and so on. Now, again, these grids can all be customized, so if there's a particular field you do or don't need, or if you need them to be landscape instead of portrait to fit more information, that's part of what we'll work on during the configuration. Now, if you're using these on paper, you pretty much have to flip through the paper resulting from the PDF file. So that PC that we're on right now that contains the charts would have a printer directly attached to it, and when the patients came in, you go ahead and print that off on the paper and put it in the manila folder and, you know, live like we did 10 years ago where the doctor carries around the folder, but at least they have that clinical information available to them. So they're not standing in front of the patient who, in the patient's mind, maybe they were just there last week, gosh, you should remember me. But since then, the provider has seen 200 other patients, so they may not remember everything. Again, this gives them that ability to have confidence in their decisions that they're making, and also builds confidence with the patient that they know why the patient's here and what their history is. So again, keeping all that available during an outage situation. So on paper, you'd flip through. If you're going to use them electronically within the four walls of that site, let's say the connection to NextGen's down, but the network is still working within that site. We've had clients that put shortcuts on the tablets of the provider to be able to get to this folder that has the charts. They can pull up the PDF file. They can go ahead and click on the bookmarks, and they can jump to any particular section that they're looking for within the chart without having to do a lot of scrolling. Now, what I've been showing so far is the modules, kind of this grid-oriented data that presents really well in this format. But we also have your EHR documents that you might want as part of the chart. And you might want the last 3 months of these or the last 3 of these, depending on what type of practice you're in. So ChartGuard will pull those documents in automatically from your EHR. In fact, this is a great way that we capture data generated from the templates in EHR, is to just get the documents that get generated from those templates. And that way, if you change the template, well, the format of the document changes, and again, we pick that up and put that in the chart. We also have your images from ICS, so those external reports that get scanned in, maybe it's an actual graphic of, in this case, an EKG or a shot of an eyeball, depending on what your specialty is. So all kinds of different things that can be pulled into these charts to have available. And like I keep saying, we'll work with you to make sure this gets set up in such a way that your providers will be happy with it when there's an outage situation. We've had a couple clients that, as part of their acceptance, they said, you know what, we're going to give these to a provider for one day. We're going to pick one of our providers and just have them work off this chart and make sure what we have in there is usable and get their sign off. And that way, if they do find something later on, it can certainly be added into the chart, but they've had the providers buy in that, yes, this is acceptable. So, and one of the other optional pieces we have is the account summary, if we want that in there, so the front desk knows if they need to collect any money from that particular patient. That's a quick overview of what the chart looks like, what the appointment looks like, a little history behind our story in creating ChartGuard, and our goal of having it be network survivable and easy to use, because your powerful yet complex system currently is unavailable to you. So we've created the antithesis of that, which leverages information in there, which is a system that's very simple but provides all the critical clinical information that you need during an outage. So Keith, I'll turn it back over to you and let you jump in with the remainder of your slides.
Okay, give me 1 second here while I... Whoop. What did I do here? Oh, here we go. There we go. So you should be seeing then the last slide of where Joe did the you know, as he went through the sample appointment book and also the chart PDF output. This is it's a complex solution behind the scenes. So, you know, I'd like to open it up right now. I'm going to go through a quick little overview of iTentive here for the next few slides. So while I'm doing that, if you'd like to, go ahead and start posting some questions. We have gotten a couple so far posted on the questions bar of the GoToWebinar. So go ahead and start posting those, and I'm going to just very quickly, just a handful of slides here. Let me go over first the ChartGuard versions. There's the Standard Edition, a Professional Edition, an Enterprise Edition. And the only reason we don't put pricing up here right now is because it's really different for everybody. It kind of depends on what you're looking for, how many locations you have, the number of charts you process per night, if you want to be able to adjust the days going forward. Like some people, for example, an OBGYN practice may not want 3 days. They may want to be able to say, you know, anybody in their third trimester, I want to see everybody's records in their third trimester, regardless if they're coming to see me the next 3 days or not, because I want to get access to that information for whatever reason. So there's all types of nuances depending upon your type of practice. So I'm kind of throwing the versions up here so you can see what they are, but please feel free to send me, either myself, and there should be a slide at the end of this that has my email address and phone number. You can send it to that, or you can even use the invitation you received from me from iTentive. You can reply back to that, and you know, we've got a staff of people here that will help match the correct version for what your needs are and get you the proper pricing quote. So let me give you a quick little rundown of iTentive. Some of you may have heard of us before, maybe not sure. We were founded in 2003. Our mission has always been to create additional value for your next-gen investment. Some of our folks, if you take 2003 and subtract it from today's date, you'll notice that that's less than 15 years, but we do have 15 years of experience because we have folks in our company that actually worked with NextGen before it was even called NextGen. So we're very deep in knowledge and expertise, and from the consulting side of NextGen as well as from the product development side. We have about 70 employees coast to coast and around 350 clients using NextGen. We are a strategic partner with them as well, and we live the NextGen experience every day. This is the only solution we work with today, and that's the whole foundation of why we exist. So that does make us the Nexperts. So I like to throw this slide in here because I think it's a cool little marketing slide here, but it kind of gives you an idea of where our clients are spread out all over the U.S. And our consultants are all over the U.S. as well, but it does give kind of a unique little picture about you know, where we go and what our capabilities are and what we're able to do. So just to give you a quick little rundown, there's very few NextGen partners out there like ourselves that can basically do the full life cycle. So not only can we do implementations and look at your and do process improvements by looking at your workflow and your practices, we can also do your enhancements and upgrades and support. But we also have an IT side of the business where we can do managed services, and basically if you're just tired of messing with NextGen, you can hand it over to us and we can totally manage this thing remotely for you. As well as we have a cloud hosting data center. And we also have solutions where we've taken some of the technologies in our hosting data center and have scaled them down into what's called a microcloud and have made that solution available to practices as well if they'd like to keep their NextGen on site. So we pretty much handle the whole gamut of things, as well as these productivity tools. You're seeing one of them right now, which is the ChartGuard one. We have another one called Refund Manager. And we have at least 3, maybe 4 new products we're bringing to the market this year. So depending upon how well that goes, we can get them through their vetting process, where we have some more tools coming. So stay tuned. You'll probably get some more webinar invites from me here shortly. So on these productivity tools, again, you've already seen ChartGuard here, but Refund Manager, quick little overview of what that does. It's not just about the refund process, although that is kind of a painful process because nobody likes to give away money. They want to keep the money they have, and but we all understand we have to refund when we're overpaid, so it is a necessary evil. But the neat part about Refund Manager is that it looks at the credit balances. So it has this neat little engine that goes through and looks at the credit balances, because it may not be the fact that it may not be a refund due at all. It just needs to be redistributed or reallocated under a different encounter. So it gives you a nice tool that goes down and scans all your charts in the system and pulls all those credit balances so that they can be evaluated and determine whether a refund truly is necessary. And then if it is, this actually integrates into most accounting systems out there, where we can actually generate the check, post the transaction in your accounting system, and then bring the transaction back and post it again into NextGen. So these are really slick little interfaces that we've written to these accounting systems that can automate that refund process if you have to do that. One of the other products we're working with right now is an archiver solution. It's a comprehensive, it has very similar outputs. It's a subset of our ChartGuard product, but basically it's designed for long-term chart storage. It could be because you have providers that are maybe leaving your practice, or maybe they're splitting off and merging, and they want to be able to just take their EHR data with them, or you may be leaving the NextGen solution and going to another one, but you want to have your data with you. So this tool is available for that long-term storage and retrieval, and that also assists practices with migrating between EHR systems. So here's the last slide here. Again, my name is Keith Justice, and there's my phone number and my email address if you have any questions, like you'd like to get a copy of the slides, or if you'd like to get a quote and discuss some of the versions and which version matches your needs. You heard from Joe Schultz earlier. Joe Schultz earlier, and there's his email address if you'd like to ask him some more technical questions about the product, or you can just run those through me and I'll coordinate those with Joe as well. So I'm seeing a couple questions out there posted. We were asked if we could provide this presentation to the attendees, and yes, we certainly can. You just shoot us an email and let me know, and I will take care of getting that in a PDF version for you. And then here's another question that was posted for you, Joe. When the system is down, how does the provider document?
Okay, that's a good question, and one we get commonly. In our goal to keep the system as simple as possible, we've elected not to have another but mini version of NextGen with its own database and such. So today, the provider documents on paper, and then that information is input when the NextGen system is back up.
Okay, thanks, Joe. I'm trying to look, is there any other questions? I'm not seeing any other questions posted. Is there anything anybody wants to ask about technology, or let me actually, there is another question that popped in here about how do you secure this information from an EPHI perspective? Since it's being distributed in a PDF format, what does iTentive recommend to secure that data? Would you like to address that one, Joe?
Definitely. When we work with you to install ChartGuard, and again, this is part of the reason we're hands-on with you on the installation, we have some recommendations for the PCs that are going to host ChartGuard out at the remote sites, because as Keith just mentioned, you're taking your PHI and putting it at other locations. The first thing we recommend is making sure you have the drives encrypted on the PC that's going to host ChartGuard. In fact, we're seeing encryption become more and more a necessity rather than a luxury within the medical community. And there are a lot of great solutions out there, some free, some included with Windows, and others that you can purchase to do encryption. In addition, you want to go ahead and lock down the permissions on that PC, so only the people who would ever need to see the charts are part of the groups that can see them. And then last, for auditing, Windows has a capability to audit portions of the file system and log who touched what files, and that would give you the ability to see who touched what charts on that PC. So that's where we start with our recommendations, and then we have some sites that have taken it a little bit further. But if you get those basics, You're getting the encryption, which is important for HIPAA compliance today. You're getting the lockdown, which again need to know. And you're getting the auditing through the Windows file system auditing.
Okay, thanks, Joe. We've had one more question posted here, which was if I'm in a group like a community health center where I have a lot of walk-ins, how do you handle dealing with walk-ins if you don't know they're going to be there in the next 3 days? What kind of solution do you have for that?
That's a good question, and thank you to whoever asked it. Walk-ins we see a lot in the community health space, as Keith just mentioned. We also see it in pediatrics, right? Kids are always getting sick at like 10 p.m. at night, and then they're needing to go into the doctor right away the next morning. So for walk-ins, we added a mode for ChartGuard where it kind of works a little reversed to what happens normally. Normally we look at the appointments and use those to generate the charts, but we have this other mode for walk-ins where what we do is up front, we work with you to generate the entire active patient population of charts. Those go out to the remote sites, and then each day the people who came in for appointments, their PDF files are regenerated with the new data and copied out. So it's kind of a little different take on how ChartGuard works, but it gives you what you need for walk-ins, which is all charts at all sites available to you when the network or NextGen is down.
Okay, thanks, Joe. I'm not seeing any additional questions being posted at this time. I am getting some comments about it being a great solution, but no more additional questions. So, folks, I appreciate your time. And if you think of anything, again, you can use the invite, or you can use the email address here on this slide and send us an email and ask us any questions you need, and we'll get the presentation to you if you'd like a copy of it. So with that, we'll go ahead and end the webinar here. Thanks again for everybody's attention. Appreciate it.